Hello, everyone. Hello, everyone. Welcome to our discussion on PTSD today. Joining us is Dr. Kok and Dr. Koster from our psychologists from our trauma recovery team. Also is Ming Vincenti, another one of our public affairs specialists here at the VA Maryland Healthcare System, and I'm Rosalia Scalia. Before we begin, I would like to remind you all to like our video, subscribe if you can, follow, and this is really good information about PTSD. So I am going to also ask you to share if you know anyone who is struggling with PTSD. So I'm going to introduce Dr. Brian Kok and Dr. Koster. Welcome so much to our live event here on social media. So let's start with just a really basic question. What is PTSD and what are the conceptions about PTSD?
Sure. So PTSD, also known as post-traumatic stress disorder, is a mental health condition that can develop after someone experiences a traumatic event. And so with PTSD, a lot of times there are a lot of misconceptions, misunderstandings. People might pick up something from movies, television shows. So there's a lot of misinformation out there. And I think one of our goals today is to talk a little bit more about what PTSD is, what are some of those common myths that get perpetuated, put out there, and how can we help correct those and spread some information about, how to treat PTSD, what to do if you think you might have some form of a trauma-related disorder, and how to ask for help.
So how does one go about even knowing that what they're experiencing is PTSD? Can you sort of talk about some of the obvious and maybe not so obvious symptoms of PTSD?
Yeah, I'd be happy to jump in there. So some of the things that we look at. So for one, if there are many different types of traumas that folks may experience. And for today's purposes, we don't have to go into all the details of what we would consider to be a qualifying traumatic event and not. But I think the main thing that folks should be on the lookout for would be some form of intrusive symptoms. And what we mean by that would be something that an experience that's akin to what we call a re-experiencing symptom. So some of the classic symptoms folks might experience would be things like unwanted memories, at times if they're triggered or cued to remember something that had happened to them, whether it was in the service or otherwise. We'll talk in just a minute about some of the myths in terms of, sometimes people come in with the thought that, I never went to combat, so I can't have PTSD. We'll talk a little bit more about just how kind of, trauma can occur at any point in the lifespan, right? As well as sometimes folks will experience nightmares where they don't necessarily have to have a replaying of the experience during sleep or in a nightmare, but often there's a really strong emotion that comes up, restless sleep. Sometimes folks, spouses or partners might end up noticing, hey, you're extremely restless in your sleep. Gives a little bit of a soft sign that, hey, maybe something's going on. So the main things that we tend to look out for would be those, what we refer to as intrusive symptoms. But then there's also a lot more to it. One of the main things that folks will talk about is feeling a really strong pressure or need to avoid situations that remind us of a trauma. And often the way I think about it is, it's like the trauma experience has kind of taken away different areas of life, right? So for example, I can't go around crowds, or I used to love going to baseball games and now I just can't tolerate it because there's so many people there. Often when we get into trauma recovery work, we're trying to help folks figure out how they can reclaim some of that ground from the trauma, right? Trying to counteract some of that avoidance in an objectively safe and therapeutic way. So those are the two big things that I tend to look out for. Dr. Brian, I don't know if there's anything you would add, but I'm often thinking about those intrusive symptoms like unwanted memories and nightmares, as well as those avoidance symptoms.
Yeah. And PTSD is a really kind of a chameleon of a disorder, right? Because you can have two people that experience similar traumas, both could have a PTSD diagnosis and look very different. And there's a host of other symptoms we look at, some things that might feel and look a little bit like depression. Difficulty getting motivated, difficulty forming connections with loved ones, feeling emotionally numb. We also see changes to physical reactions. So one of the big ones is feeling like you're constantly on guard, keyed up, or on edge. A lot of people report difficulty managing anger or aggression. We might see difficulty concentrating as well. And so, long story short, there are a lot of symptoms associated with PTSD. And the best way to understand if you do have PTSD is to have those symptoms evaluated by a trained professional. So having someone that understands the diagnosis, that can do a structured assessment of your experiences, that's going to be the best way. If you do suspect you might have some of those symptoms.
And I would just piggyback off of what Dr. Brian's saying there, that, by providing this information, we're not saying that you need to know with certainty before you go in looking for help, but kind of a sneaking suspicion, or noticing, hey, that nightmare thing that he mentioned, or those unwanted memories, or we'll even talk a little bit about how some folks might struggle with things like fireworks around the 4th of July, right? If you're noticing those kind of patterns, that's often a good sign that it might make some sense to either start by checking with your PCP or primary care doc. And before we end here, we'll also mention what the number is for our local VA here in Maryland if you are interested in scheduling a mental health triage clinic appointment. So, just food for thought, kind of just to kind of be on the lookout. But we're not suggesting that anyone needs to be 100% certain that what they're experiencing is PTSD before coming in for help. We don't want to create that barrier, of course.
So can someone who is struggling with PTSD and not know it, does it impact their family relationships? And how is that? What have you seen in terms? Is it sometimes not the person who's struggling, but maybe their family member who is saying something's up here?
Sure. I think, PTSD is it's far reaching. And a lot of times I'll have someone come in and they'll say, oh, my spouse told me I needed to get help. Right. And so a lot of times it is the spouse or a family member that starts to notice these changes, especially if this is something that is more of a subtle change in behavior. Right. A lot of times it's hard to notice our own behaviors have changed. Other people tend to pick on that a little bit quicker. And we notice, and I mentioned some of those symptoms like, pulling back from people, feeling emotionally numb. It is quite common that we see family members experience these PTSD symptoms in secondhand. And so, yes, it's very common if you notice your loved one has a change in their behavior. Obviously, the first thing I would recommend is talk with them. Right, you don't have to immediately say, you've got PTSD, go get care, but have that discussion, start to see what's going on. But yeah, I think absolutely, if you or a loved one or spouse or a family member is showing some of those different behaviors or symptoms, have a conversation with them.
I think I was thinking kind of the same thing that Rosalia, when she asked it, she took the words right out of my mouth. Do you have any advice on how to broach the subject if someone who you think is experiencing PTSD is very sensitive about it? So when you ask if they immediately say, no, I'm fine, leave me alone. What kind of recommendations do you have in broaching that subject?
It's a good question. And again, I think it tends to be very kind of individualized. One thought that I have would be, for one, to be aware of some of the services that are available specifically for family members in the area. So for one, kind of within VA, whether it's through kind of our internal referrals or community care, there is the possibility of couples therapy if both partners are on board. But there's also, if there's a spouse or a family member who really is concerned and feels like they've kind of tried to share with their loved one, but it's maybe causing more problems or it's not necessarily going well, it could be an indication that it makes sense to reach out for your own care. And one of the clinics that I like to make sure folks are aware of, especially for family members of our veterans here, is called the Cohen Clinic down in Silver Spring. If you were to Google just Easter Seals at Cohen Clinic, this is a clinic that will see both veterans as well as family members, spouses, and dependents. So that could be the kind of thing that could very well be a presenting concern for a course of therapy, right? Like, I'm doing my best to support my loved one. I'm not quite sure how to do it. My intentions are really pure, but for whatever reason, it ends up not necessarily going the direction that I'd want. I think that would actually be a lovely reason for someone to seek some care. So that's just one resource that's out there. It's called the Cohen Clinic down in Silver Spring. If you were to Google them, there's more information about how folks would get involved, but they'll see veterans, they'll see family members, they'll see dependents as well. And of course, as I mentioned, similarly to what we said about how someone would get involved in care here in the Maryland VA, if you were to chat with your primary care doc and were seeking let's say, a referral to our family intervention team, that could be an area as well.
So we also know that there are some really myths and misconceptions about PTSD. Can you bust some of the myths that are circulating out there, especially among our veterans?
I brought my best Mythbusters mustache to try and channel the Mythbuster guys. But yeah, we've got 5 myths that we're going to kind of talk through today in no particular order. But these are ones that we were kind of talking through about what we hear the most from people coming in, what we hear, just kind of people talking about and either on social media or kind of just in everyday life. So we'll talk through a couple of those. I think the first one we want to talk through is the idea that experiencing a traumatic event will always lead to PTSD. And one thing we know from the research and the literature out there is that this is not the case. And in fact, the majority of people out there, the majority of American adults have experienced a PTSD, we call it a qualifying trauma, some kind of traumatic event throughout their lifespan. And within that, only a small fraction of people go on to develop some kind of trauma-related disorder. And we're looking around the course of about, of the people that experience that, maybe about 10 to 20%, depending on what types of traumas, the context, will actually go on to have longer-term reactions. In most cases, people will experience some symptoms after they go through a trauma. And that's not a bad thing. That's actually a natural response of our body, right? If you're having something that was life-threatening or very stressful, you're going to be shaken up. That doesn't mean anything's broken. That means things are working the way they should. And over the course of a couple weeks to months, most people notice those symptoms are going to start to come down. And usually within the span of a couple months, you're going to return to baseline. And that's for the majority of people who experience a traumatic event. Again, not for everybody, and that's why we're here today. But that's one of the myths that we've come across a lot, is that trauma equals PTSD. But we know, in fact, that is not the case for most people.
And I would just add to that one of the reasons it's important to kind of have an understanding there is that if we're seeing that some folks their PTSD-like symptoms are resolving after trauma and some they aren't, the research can show us a little bit of where folks are getting stuck in recovery. And if we know where people are getting stuck in that natural recovery process, it tells us a lot about how we can help them get unstuck, which goes a little bit more into what our PTSD treatments look like. So it's a bit of a tricky thing, right? We're not suggesting in any way that the experience of a trauma is not always going to be distressing. I think universally it will be distressing. And, the unfortunate reality is, Dr. Bryan said, is the majority of us will experience a trauma throughout the course of our lives, but not everybody goes on to experience the long-term PTSD symptoms. And that's when folks are experiencing those long-term symptoms. That's where we're saying, there's help out here. Is it okay if I jump into the next to another myth that we were talking about? One of the ones, I think I already hinted at this a little bit, this idea of I never went to combat, so I can't have PTSD. I've heard that not just from vets, but also from folks kind of out in the world suggesting I think because of maybe media coverage or the way in which, kind of narrative is shaped out in the world, sometimes people almost have this mental pairing of war and combat and PTSD as though they're so intertwined. And of course they are, but I think it's a yes and type of thing. So the way that I think about it is, of course, combat is something that very well can lead and often does lead to PTSD. But the reality is trauma that occurs at any point in the lifespan, whether it's in childhood, or, it could be a car accident that somebody got in a year back, right? And they discharged from the service back in the 70s. Right here in our trauma recovery program in Maryland, we're not excluding people based on, oh, that's not a combat trauma, we won't see you, right? We're interested in the full course of somebody's lifespan. When we do our assessments, we're looking at childhood, we're looking at military service, adulthood, and more recently. So really at any point in someone's lifespan, if there's a traumatic event, whether it's a car accident, natural disaster, interpersonal violence, all of those different types of things, those all can and do result in PTSD. So I think it's really important to kind of decouple that idea that only combat is something that would lead to PTSD. And the next step being only combat is something that people can have treatment for here in the VA. That's really not the case.
I'll add one thing to that, and I think in addition to this idea, we've got multiple types of traumas, right? this idea that trauma by its nature is subjective, which means that, you could have two people that experience the same trauma. One person could shrug it off and the other person has a very strong reaction. And so, even if you've experienced something that you think, oh, this shouldn't be impacting me, or I should get over this, right? Keeping in mind that, if it's causing issues, right, that could very well be a lasting traumatic experience. And that could be one of those indicators to talk with someone and start maybe doing some research, asking questions.
Yeah.
That's good to know, especially these days where there's a lot of multiple shootings that don't involve any kind of military, like the school shootings or the event that happened in Las Vegas at a concert. So there seems to be a lot of traumatic events happening that could lead to people being unable to shrug off that trauma. So you mentioned 5 myths. We talked about 2. What is number 3? What is the third one?
Yeah, I think the next one that I wanted to highlight, and Dr. Bryant, I don't mean to cut you off. This one is just kind of a bit of a passion of mine and a soapbox that I take. Sometimes I will hear this from the folks that I work with, this idea of feeling as though PTSD or the symptoms are a sign of weakness. I think actually if we look at that in a much more nuanced way, we realize that the symptoms that folks sometimes come in with PTSD are actually a sign of the body and mind attempting to adjust to a really abnormal situation, right? So there's the saying that PTSD symptoms are a normal reaction to an abnormal situation. And to make an analogy, I sometimes think of it almost like calluses, right? Like I'm a runner, and not to share any details, but I get calluses on my feet because I'm running miles, right? My body is trying to kind of adjust to the abnormal circumstance that it wasn't in previously. There's a little bit of that going on with PTSD, right? That there's this kind of attempt for the body to adjust because the circumstance is so abnormal and so atypical, right? We see that really clearly when someone has, for example, hypervigilance symptoms. So for example, we'll talk just a minute about 4th of July fireworks. If someone's in a combat zone and they're hearing mortars, their body and their mind have trained them to be very, very quick to respond. That's a life or death type of thing. That to me doesn't necessarily sound like a sign of weakness. That sounds to me like an adaptive kind of superpower in the correct context. The problem becomes when the circumstances have changed so much. And that's where treatment comes in to help folks start to adjust a little bit. So that's how I think of it in terms of, this idea that PTSD is a sign of weakness. I actually think that, obviously we can think a little bit about the symptoms and how they present. And the very act of coming in for treatment is often very much a sign of strength, very much a sign of resilience, and readiness to kind of, take some risks and share with somebody.
Yeah, and I also think there's there's this idea of, factors that you can control, factors you can't control. And for PTSD, we know that development of long-term symptoms has both, right? And we can't control the way our brains are wired, right? We can't control if we have a genetic predisposition for certain types of thinking, thoughts, or patterns. And we know things like early life experiences can also change how someone experiences later life traumas. And so when we look at this, right, PTSD being a sign of weakness is basically saying things you can't control are a sign of weakness, which we know is kind of a silly thought to have. So really understanding that, anyone can get PTSD, right? It doesn't pick or choose, right? We want to be able to understand that, having those symptoms, having those issues, and more importantly, asking for help, none of those are signs of weakness. And arguably those are signs of strength, because it's a lot easier to not seek help, to not work on yourself. And asking for help, going out there, that's what takes strength.
I do think that also really dovetails really nicely into that other myth we were thinking of, this idea that PTSD can't be treated. At this point, a quick Google search will bring you to a lot of information. I mean, if you're looking especially for where really credible information will lie, I check out what the National Center for PTSD is putting out there. There are a couple of different resources, including one called the PTSD Decision Aid. There's also a program called About Face, which goes through what the different treatments are. And, at this point, there's really a pretty intense amount of information out there about which treatments are effective and which maybe not so much. And the type of treatments that we offer here within our trauma recovery program, or we refer to them as first line, right? They're the ones that there's the most research support for. the main ones being cognitive processing therapy, prolonged exposure, EMDR, and written exposure therapy. And we're not going to go into all of those, but the reason I'm mentioning all four is at this point, we're fortunate to be at a time where the science has gotten to a place where we actually have options, right? As opposed to either we have no idea what to do about this, or there's only one thing that we can do about this, right? So when we're meeting with folks for the first time, when they come into treatment, after we kind of clarify what the diagnosis is and how we might be able to help, we go through what we refer to as a shared decision-making process, right? We basically say, here's the menu of different options. We talk through them and we say, which do you think would be most effective for you, right? And we offer our professional input, but we're not forcing anybody into a specific treatment. If they hear about one and they say, no, that's not for me, that doesn't sound like a good fit, we're not going to force anybody into that plan of care. We're going to pivot to something that seems more palatable, right? But so the bottom line being, there is a lot of evidence here that there are different treatments that are effective, those individual psychotherapy, talk therapy options. We also do have medication options, and there's a really lovely, excellent prescriber here in our trauma recovery program in Maryland, Dr. Noah Linden, that if someone's interested in working with him, we make that connection as well. But we have a really kind of robust team. There's quite a few of us. We're doing this work on a daily basis. So that myth that PTSD can't be treated, I would love to pop that one if we can. I'd love to bust that one as quickly as possible.
Yeah.
So I was going to say, what can you talk about our services for veterans or who are struggling with PTSD? For instance, is it outpatient? Is it inpatient? Like, what can veterans expect when they are screened positive for PTSD? What can they expect in their treatment plan?
Sure. So our clinic is primarily outpatient. So a typical course of treatment would be you're meeting with a provider, typically once a week, usually for an hour session for the span of about 10 to 15 weeks. During that time frame, we're working through one of those treatments that Dr. Dan was mentioning. And it follows a framework without becoming, it's not a cookie cutter, but it gives us that backbone that we can use to build on for structure and accountability to help you work through that. If it looks like, a higher level of care is needed, the VA healthcare system has different affiliate sites, different residential programs throughout the country. Those are also options. Usually we try the first line treatment as an outpatient therapy. If that doesn't work, we think about escalating to a residential level of care. But I would say that the first stop would be, talking with either your primary care provider or making an appointment for a triage visit, which we'll talk about how to do that in a little bit. And then trying out one of these therapies, since we know these have very good outcomes, very good support for them. So that would be the first step that we recommend for most folks that come through our clinic.
Can you talk a little bit about dual diagnosis? I mean, I know that the VA Maryland healthcare system is known for being one of the places within the VA that treats dual diagnosis because PTSD often comes with other comorbidities like maybe substance abuse or alcohol. So can you talk about the connection with PTSD and maybe how people's coping skills lead to other things and how those are either treated simultaneously or how those are approached within our healthcare system?
That's a great question. It's a really important one. When we were talking about the idea of avoidance before, sometimes for self-medication purposes, because maybe folks can't tolerate the feelings that they're feeling, it's not uncommon for substance use to end up kind of showing up as a crutch to kind of temporarily ameliorate symptoms, but of course creating more problems in the long run. And I think I'm glad that you're mentioning dual diagnosis, because I think that the issue, if we don't take a dual diagnosis perspective, if someone has both PTSD and a substance use concern, the issue we can run into is a revolving door kind of thing where, oh my gosh, I'm coming in for PTSD symptoms, but I'm told I need to get my substance use under control first. And now I'm doing the substance use treatment, but my PTSD is not managed. And round and round and round we go. There is what we try to do is we try to take a sensible approach that if somebody is at a place where they can benefit from an individual therapy focused on both PTSD and substance use, we will offer that. Now, with that being said, if a substance use condition is so out of control that there are immediate safety issues, we obviously need to take care of that first. But there are some different programs in our trauma recovery program. There are some group options that look at dual diagnosis where, vets would have a chance to sit in with other vets who are experiencing similar things. There's groups that we refer to as Seeking Safety. Seeking Safety is an evidence-based treatment that really looks at co-occurring PTSD and substance use and provides a lot of education about how folks are actually able to develop new coping skills along the way. And then there's a program in a evidence-based treatment in individual therapy that's called COPE, which is basically prolonged exposure for someone who's experiencing both PTSD and substance use. And just like Dr. Bryan was saying, how it's not a cookie cutter, but it provides a framework, that would be an opportunity for somebody who, maybe previously would be told, substance use is too problematic, go get that treated first. That would be an opportunity for them to have the treatment under one roof with a provider who's able to kind of manage both and appreciate the complexity and the interconnections between the two. But these are really complex areas, and I don't necessarily think I can sum it up so elegantly in just like 5 minutes or so. But Dr. Bryan, did I miss anything about the dual diagnosis piece that you would add?
No, I think you hit all the key points, and all the, the reason we have these treatments is because it's so common, right? And PTSD, more often than not, happens in the context of something else. Whether that's substance use or anxiety or depression, it's very rare that we just see, one thing come through the door. And for good reason, right? Is that, we see people try to manage these symptoms on their own for years, sometimes, trying to keep it at bay. And usually when they start to come in for therapy is when those skills are not working. And that's where we start to see, like, drinking to help reduce the symptoms is now drinking to fall asleep to get to the workday. And that's where these treatments come in and help you where you're at.
One of our viewers is saying that she likes the CPT forum for therapy. For those of us who are not veterans and who are maybe family members, can you please explain what CPT forum is?
Yeah, and VA is one of those places where abbreviations run wild. So I just want to acknowledge that. So CPT stands for Cognitive Processing Therapy. If you threw that into Google, you'd find a lot of results, including I mentioned the PTSD's decision aid in the About Face. Often I refer folks to the About Face program has some examples of videos that veterans have put out, that's basically explaining what the process looks like. So if you wanted a bit of a deeper dive to understand what that looks like, I would Google About Face, find the CPT or cognitive processing therapy videos, and you'll be able to hear it in a veteran's words. But basically the way that I would describe it is it's a cognitive behavioral therapy, which means we're looking at how the trauma changed our thoughts about ourselves, other people in the world. And through the process, it offers us a safe, therapeutic, structured way to talk about the trauma and its impact. And ultimately, the goal is for us as providers to put ourselves out of a job, right? We don't want to create dependency. We don't want to have it be a situation where someone needs to come in every week for the rest of their lives. So the way that we do that is we have between session activities that next time someone's experiencing a trauma cue or a trigger out in the world, they can go ahead and they can practice the cognitive behavioral process, right? The kind of worksheets that help them walk through coping. So really it is kind of a way of ultimately putting ourselves out of a job. That's the ultimate wish and the ultimate dream, and to create as much autonomy for our clients as possible. I mean, we were talking about, for example, 4th of July fireworks, right? If somebody were to, they're anticipating we're just a few weeks away. I know from years past, this has been challenging for me. My guess is that's going to bring up some similar strong thoughts and feelings that they've experienced before. And I might talk to one of my clients about how they can use a cognitive behavioral therapy to get ahead of that, right? To kind of notice what some of the thoughts are, to challenge them, and to help themselves calm down and soothe a little bit more quickly, as opposed to being in that state of really kind of dysregulation for the rest of the night, for example. So yeah, again, I would check it out, Google cognitive processing therapy, and you can find tons of information, including a bunch of good info from folks who have been through the treatment.
So aside from CPT, I know there's another major form of treatment that we deploy here at the VA Maryland healthcare system, and probably all VAs. What is that other one?
So we got a couple. So CPT is one, cognitive processing therapy. Another one of our frontline treatments is called prolonged exposure, which basically has you going through the trauma memory as a way of reprocessing it and ultimately coming to terms and accepting that as something that's happened in your life. So an exposure-based therapy, if you've ever known anyone who's got like a phobia or fear, same general principle, is a gradual exposure to the thing that brings up the anxiety, and over time helping you build up a tolerance. And the PE, the prolonged exposure, is pretty cool because in addition to working through the trauma itself, we actually get you to go out and do real world exposures. So this could be anything from, eating at a restaurant with your back to the door, or, with the fireworks, going out and attending a fireworks celebration. And the idea is to confront the avoidance, that urge to leave. We now have you engaging instead. And we pick safe situations where the risk is very low, and we have you go there and start to relearn your views on safety or trust or whatever that might be. So that's the prolonged exposure. And then the other frontline treatment we use is called EMDR, eye movement desensitization and reprocessing, which has you thinking about the traumatic event. So you're not talking through it, but you're thinking about it while engaging in a distraction task. Sometimes that would be following a clinician's hand or watching a light move across the screen, or sometimes we'll be doing a tapping exercise. But the idea is by doing this, you're actually stimulating different parts of your brain to helping you reprocess that information in a different way. And EMDR is very helpful for people that do have multiple traumatic experiences, since you don't have to focus on a specific event or a specific experience. It could potentially help you work through kind of broader issues, broader reactions. And any extra things you want to add on that, Dan?
I think you covered it. I think the one thing I'd go back to is, when you were describing the part of prolonged exposure that has us out in the world doing things, emphasis on strategic, right? We're very strategic about it. We make sure that we're figuring out things that are objectively safe, but the trauma has made feel unsafe. And we work up gradually in a way that's tolerable, right? And this kind of goes back to the idea of kind of reclaiming turf from trauma to a certain extent, one step at a time. But again, I think I'd go back to emphasizing that there's not a one size fits all, and we're really interested in kind of meeting the vet where they're at to figure out which of these different options make sense. And we'll obviously talk through what the options are, and some of those different resources, like I mentioned, the About Face resource that's out there. We might even go through and watch some videos and say, like, okay, here's what this vet is doing. How would that be for you? Does this seem reasonable? And if you say no way, we're not going to pursue it. We're going to look over here.
So I also want to talk about the VA's tool, PTSD Coach. Do you advise or recommend that to your patients to employ? Do you know about that mobile app that VA has, PTSD Coach? And if you do, can you talk about that?
Sure. I like PTSD Coach. It's largely a symptom management tool. So I would not put it at the same level as if you were doing a talk therapy. But if you're looking for ways to help maybe take the edge off for some symptoms, it's got some really good techniques, practices, coping skills that can help you manage anxiety in the day-to-day. So the way that I like to use the app most is that it's got about a dozen or so different practices, things like mindfulness, meditation, deep breathing, muscle relaxation. And the thing that I like best about the PTSD Coach is that it is 100% free. It does not collect any sketchy data like all those other apps do up there. Nothing gets uploaded into any cloud. So it is safe, secure, it's well designed. And I use it to help support folks that I'm working with. So we're doing the therapy, we're doing kind of this work in session. And if they need something extra to help manage some of those symptoms on the side, that's where I think the PE Coach can be super helpful.
I think it's also safe to say that some of the grounding, more kind of deep breathing, more meditative skills can be really helpful in a context like what's coming up with the 4th of July. If folks are concerned about fireworks, for example. Another reason that I like these apps, I'm thinking specifically, I often refer to the COVID Coach app, which was originally made during COVID, but there's just a bunch of skills built in. There's also some self-monitoring tools. And I like that, for example, if we're finishing up in treatment and somebody's symptoms are at a much better place than they were when we came in, we might say, all right, on a monthly or quarterly basis, whatever works for you, go ahead and fill out those forms that you completed here. And if you're noticing they're popping up, you should probably give me a call and we can talk about, treatment planning, for example. So, in addition to those actual skill-based modules, having some self-monitoring tools is really important because, things might change over time and that's okay. And it's good to kind of catch backsliding sooner rather than later instead of, oh my gosh, 3 years went back and I'm all the way back where I started. What do I do?
So let's talk about 4th of July, because this is a time where people who are either in treatment might face a little bit of a challenge, or people who are not in treatment at all might face a bigger challenge, but also a good time to test people who are post-treatment. So let's talk about 4th of July and the triggers that it brings for people with PTSD, particularly veterans who have been in combat.
Yeah, and I think, there's a couple different triggers, right? And I think probably the most obvious one is the fireworks, right? Loud noises, bright flashes can often bring back experiences of, explosions during combat. I think some of the less known ones is that it can also bring up a lot of emotional reactions, right? People think about, people that they've lost over time. And there's a lot of different layers to unpack. And I think you're right. It is a very challenging time for all those reasons. And I think, one of the things that I encourage people to do, especially if they're, if they haven't entered in treatment yet, or if they're on the fence, or for whatever reason, they're not quite at the level that they want to go out there and kind of test themselves, is prepare, right? And so if you know that loud noises are going to be a trigger, invest in some earplugs, or some earplugs under earphones, right? Or, give yourself some space. If you know that going to a crowded event is going to bring up your anxiety, see if there's a way you could go to somewhere that's a little bit less crowded, or watch from a distance. But I think really starting to look at, understanding what are the types of things that are going to make you feel uncomfortable, bring some of those symptoms up, doing some planning around that. And also if you do have, family members, like explaining to them what is going to be helpful and unhelpful. Because I think one of the hardest things is if someone doesn't understand why their spouse is suddenly cold and not responding to them, or why they just walked away, they might think it's maybe something they did. So having a discussion, letting them know that, hey, if I start to have a reaction, here's what I'm going to do, here's what I'd like you to do, is providing a plan, clear communication so that everyone's on the same page.
So can you give out some tips for veterans who are in, 4th of July means picnics, also in addition to fireworks, being around people who may not understand the veteran experience. Do you want to give some tips to non-veterans, family members, like of what not to do around someone who, you don't ask certain questions? What are the advices that you want to give to non-veterans who have veterans among them about what are helpful and supportive behaviors and what are not so helpful and supportive behaviors?
I think that you're kind of hinting at something which is important. For one, I do think we want to, of course, practice our common sense when it comes to, if we're trying to support somebody, we don't want to accidentally draw more unwanted attention towards them, right? So the way that I would approach, and again, this is very individual and everybody kind of knows their own family members better than, of course, someone like me who's speaking on a screen ever could. But I think if I'm concerned about somebody, or I'm noticing something, or I kind of just have that suspicion, like, oh my gosh, I find myself dreading this because I know my partner's going to really be struggling with the picnic and the fireworks and all that kind of stuff. I think being tactful about when and how we raise the discussion is probably the first thing, right? So of course we don't want to kind of call somebody out, or we don't want to kind of try to make all kinds of decisions for them. What I might try to do is strategize a little bit, right? Like we might, there's the old saying that goes, strike while the iron is cold. Kind of thinking the opposite of strike while the iron is hot, right? When the crisis is among us, sometimes I think it might be a little bit better to approach in anticipation at a time when we know the person's going to be a little bit more receptive, and we can talk about, hey, how can I support you? Right? As opposed to kind of coming in with a pre-planned agenda because I heard this on the internet or this Instagram or TikTok thread that I follow, right? Kind of asking, what do you need in this moment? And, I also think kind of using it as an opportunity, this maybe goes a little bit more to the veterans experience, but to use it as an opportunity to check in, right? Like if I find myself dreading this time, that probably shows that there's something that needs to be addressed, right? Or could potentially be addressed in treatment. A family member or a loved one could also kind of check in with themselves as well and say, hey, I kind of recognize those same patterns that they were talking about on that screen with my vet or, my loved one, my mom, dad, father, whoever it is. Maybe use that as an opportunity to find a more tactful way to raise the question.
And I'll add in one quick kind of addition there, right? Is that when I talk with my vets, hands down, the most triggering question that you should not ask is, did you kill anyone? That is one of the most unhelpful, disrespectful questions that you could ask someone if you are not close to them. And I think you're understanding that people have various degrees of connection to their military history, right? So don't make assumptions about someone's service. Remember that, veterans, service members are people too. You could ask them about literally anything. Go talk about the Orioles, talk about the weather, right? Doesn't always just have to be about military service.
So that's a very important thing for non-veterans to know, like when you're at a family party, and we all know what those family parties could be like. There's triggering events for a lot of other different things. But if you want to support your veteran or your loved one who is a veteran, maybe running interference with, nosy Aunt Sadie or, drunk uncle or whatever, or to, that. But also, what are some tips for veterans who are experiencing stress during is there any kind of strategy that couples could work out if they're at an event and things start getting, a little stressful, like code words to leave? Like, how do you advise? What are some strategies that couples or family members can put in place before they go someplace and before, strike while the iron is cold kind of thing?
Yeah, I think similar to like the fireworks, right? It's like make a plan, right? If you're going somewhere and you got, old drunk Uncle Jack, right, going off, like have there be, like you said, a code word or a signal or, something that, I got to go, to the restroom, take a break, right? Having that in advance, again, can help prevent any miscommunications, can help prevent taking offense. Being able to kind of structure, what you're doing. So if this is a 5-hour event and you only want to stay there for an hour, pick an hour that feels right for you. And then I think, again, this all goes back to kind of communication is talking with your spouse, talking with your family, letting them know what to expect, letting them know it's not their fault if you start to feel anxious. But again, I think communication, setting a plan is still going to be the best approach to take there.
So how can veterans get help? I mean, do they need to go to their PCP provider first? Can they call the mental health facility? What is the most efficient and easiest way for veterans to seek help for PTSD or any other mental health or related, like let's say they're struggling with some sort of substance use and PTSD? What is the best way for them to get help in the fastest way?
So a couple of different options. So you mentioned primary care docs. Or primary care providers often are a great place to start, especially since they already, in many cases, have a pre-existing relationship with the veteran. What a primary care doc would do would be learn a little bit more about what's going on and then submit an appropriate consult, often to what's referred to as our primary care mental health integration clinic, which would be mental health providers that are embedded in primary care who would then be able to help the veteran talk through options within the system. Alternatively, if somebody wanted to schedule for our mental health triage clinic, this would be an outward facing thing where somebody could pick up the phone and they could go ahead and make a call. The mental health triage clinic number is 410-605-7417.
Can you give me that number again so I can put it in the chat for?
Yeah, so it's 410-605-7417.
7417. And
right.
This is for the mental health triage.
That's right. That's the mental health triage clinic. Not to kind of offer too many options, but there is a lot out there. I would also consider checking out the vet centers. So if folks have qualifying service, ranging from deployment to a combat zone, experience of a military sexual trauma, even actually folks who are using educational benefits like GI Bill would qualify. Vet centers, there are a bunch of them kind of located throughout the state in the region. There's one up kind of in the Pikesville area. There's one in Annapolis, right? So they're vet centers all over the place. They would offer individual therapy as well as a lot of group therapy options. And if you were to Google vet centers or vet center locator, you'd be able to find which is nearest you. I mentioned before the Easter Seals and the Cohen Clinic location that's outside of VA. It's not a free clinic, but they do have a sliding scale and they'll accept insurance, a great option for family members, dependents, and loved ones, including folks who may have concerns about their discharge status and whether or not they would qualify for VA care. And then, of course, 24/7, there's 988 in the Veterans Crisis Line. If someone's in danger of immediate self or other harm, there's 24/7 support there in the form of 988. And of course, there's, a local ER, 911 if folks need to reach out. So I know that there's kind of a lot, but I think that the two main takeaways from that would be a primary care provider would be a great place to start, especially, really, if someone's being seen within VA. And then the mental health triage clinic at that number that we put in the chat. So 410-605-7417. And I see it looks like a comment. Vet centers are amazingly inspired, and I agree with that. They're doing excellent work in the community. And I see that as kind of like the term being a force multiplier, right? That there are different settings that are kind of more embedded where folks are living, and they're offering all kinds of different therapy, and often are a little bit less concerned with time constraints than some VA clinics will be. So often offers a little bit more flexibility than maybe if somebody were, in our trauma recovery program doing a 12 to 16 week treatment.
So is there anything that we didn't ask about PTSD that you want everyone to know? And, do you have any other thing to say about PTSD that can ease or help or soothe veterans and their family members, especially as we're going into the July 4th holiday season?
I think if I had to have a kind of a take-home message, it would be, PTSD is a very real condition, right? It is very treatable, and it also is a very big factor about where you are in your own recovery. And so if you're listening to this today and you decide that this is not something you want to do right now, that's okay, right? Give yourself some time, space, being able to assess where you're at, what feels right for you. The VA's not going anywhere. We'll be here 6 months, a year from now. But I think, doing research, right? And don't take our word for it. Go out there, do some Googling, start to do some research on the National Center for PTSD. But if you're on the fence about therapy, start to ask yourself, is this how I want things to be long-term? Is this where I want to see myself in 5 years, 10 years? And if the answer is no, that might be a good sign to try out some therapy, whether that's here at the VA Maryland, whether that's trying somewhere out in the community, but thinking about, the first step to change is making a change.
And I would just say, I think that's all really well put, Dr. Bryan. I would just add, one of the things that I'm often struck by is, the kind of treatments that we offer are challenging in a lot of ways because folks come in with maybe years and years of not having a chance to talk about it. And I'll often ask folks after treatment, do you have any regrets about what we just did here? And nobody's ever said yes. Nobody's ever been like, I regret coming in and talking through this. More often than not, folks are really pleasantly surprised. And it's kind of feels more akin to the kind of burn that comes from working out at a gym than, being burnt by a stove per se, right? Like often it's kind of more of a cathartic, helpful type of experience. So if you find yourself feeling really hesitant and you're not quite sure where to start, or you're not quite sure, if this would be in your best interest, I think, kind of taking one of those first steps, if the time is right, to check with your PCP or try that triage clinic number might be a good place to start.
Okay, I want to thank everyone who's watching for joining us. I also would like to thank Dr. Koster and Dr. Kok for joining us and giving us the skinny, spilling the tea about PTSD. I want to remind veterans to definitely, it takes a lot of strength to come in and get some care and help. Is there anything else anyone wants to say before we sign off?
I think we're good.
Thanks for having us.
Thank you. Thank you so much for joining, and talk to you soon.